Good afternoon, dear colleagues. My name is Anastasia Lapshina. I'm a doctor practicing anesthetic medicine, and I'm speaker of Innoaesthetics laboratory. So today we will have really very interesting topic because we will discuss different treatments and different kinds of protocols that we can use for the treatment of our patient with different kinds of trichological issues, let's say. So, of course, especially now during the period of autumn, we have really a lot of such kind of patients with different types of hair loss. So today we will discuss the main etiological factors, the main reasons of different kinds of alopecia, and how to treat it in the most effective way. First of all, I would like to share with you some results that we obtained with the help of the products of Innoaesthetics laboratory. So here you can see the patient after 4 sessions and after 8 sessions using TDS Hair Loss Control. We can see really a significant improvement in the density of hair, in the quality of hair. Also on the trichoscopy, we can see that even the quality of hair is much better. It's more thick. Also here, better quality of hair. Again, patient after 4 sessions and 8 sessions using hair loss control. Really very good results. Improvement in the quality of hair, more thick, the density is much better. This is the female patient after 8 sessions of Hair Vital. So here the main demand was improvement of quality of hair, strengthening hair, stimulation of growth. Again, Hair Vital and 8 sessions. The results of the trichoscopy. So actually these are those results which you can obtain using INNO-TDS Hair Loss Control and Hair Vital depending on the types of alopecia. So let's discuss what are the main etiological factors and what is the main classification of alopecia and those kinds of alopecia that we are working with. So first of all, that can be androgenetic alopecia. And unfortunately, this is an issue not only for male patients, it can also be a problematic for our female patients, especially for those who have certain hormonal disbalance, because one of the main etiological factor of this kind of alopecia is the hyperactivity of androgens, and usually it is associated with the hyperactivity of 5-alpha reductase. So it's more usually male patients are most prone to that, but also in the case of some kind of, for example, polycystic ovaries or other hormonal disbalance, also our female patients also can be prone to that. And this problem is associated with the miniaturization of the hair follicles. Usually this is the thinning of hair in the specific areas, those areas which are hormonal dependent. So mostly we are talking about parietal region, about temporal region. Sometimes it can be in the frontal area as well. During the trichoscopy, we also can notice the dystrophy of the follicles, especially during the first year of the starting the problem. But on the second and third stages, during the progress of the problem, we already can see them some signs of the scars. So we can notice the spots of yellow color, of brownish color. There are specific changes in the hair in general. It becomes more fluffy. Sometimes we can notice the discoloration, so it's not so bright, it's not so thick. And it usually that would be in the specific areas for both, for men and women. So this is parietal area, this is temple region. In the female patients, actually, during the androgenetic alopecia, the signs would be completely the same. The miniaturization of the hair follicle. We can see that the hair, because it becomes more fluffy, it will grow horizontally, not vertically like it should. Can be hyperpigmentation of hair, especially in the hormonal dependent zones, and excessive oily scalp. So sometimes such kind of patients, they are coming just with the problem of the oily skin or problem of the oily scalp, and they will say that unfortunately they have to wash their hair minimum once a day, sometimes twice a day, and only after that they will start to notice the loss of the hair, for example. So this is also the one of the signs of the androgenic alopecia, which will start from the hyperactivity of the sebaceous glands. On the trichoscopy in androgenic alopecia, we can see yellow spots or brownish spots, as you can see here. And on 1 square centimeter, there would be more than 4 yellow spots. The decrease of the diameter of the hair, and of course, the whole density of the hair will be less. In the case of telogen hair loss, there would be a bit different symptoms. So normally patients are not talking about the oily scalp. So this is something that mostly would happen during the autumn period, during the spring period, and or after some trigger. So if during taking the anamnesis of the patient, you will ask like, what happened? Maybe something changed. Maybe you have a specific diet. Maybe you had some stress. Some patients are saying that, no, recently I didn't have anything. But actually, this is not that happening recently. So usually taking the anamnesis, we have to ask about the triggers that could be 3-4 months ago. Because telogenic alopecia, after some kind of stress, after some kind of intoxication, after some kind of virus, because I'm sure that you have patients after COVID, especially before, and you know that there were a lot of patients who were coming after that, especially after 3 or 4 months after having COVID, and they really have very serious issues with the hair. So in the trichoscopy of the telogenic alopecia, we will see the weakening of the hair that could be in the temporal region, but I would say that here we don't see really some areas that would be damaged more than the others. So in general, that is the problem that occurs in all the areas of the scalp, not like with androgenic alopecia, when we are talking about hormonal dependent and hormonal independent zones. So here we can see empty follicles, but the hair would grow vertically. It's not so fluffy, and it will not grow horizontally like we see in the case of androgenic alopecia. There can be some changes of the skin around the follicle, like the changes in the pigmentation. And of course, there would be changes in the thickness of the hair. So mostly talking about telogen alopecia, we can distinguish acute and chronic alopecia. Acute is the kind of telogenetic alopecia, which we can notice after 3-4 months, after some cause, stress, COVID, intoxication, some injuries, traumas, and so on. And normally, acute kind of alopecia will resolve in 6 months, even if the patient will not do anything. But in the case, if in 6 months the patient still notice hair loss, so there is no any kind of improvement, here we can already talk about chronic alopecia, and unfortunately, in these cases, we need to do some kind of professional treatment. So here we understand that we have to support, we have to nourish such kind of hair. There could be actually different reasons of the chronic alopecia. That could be different deficiencies, especially the deficiency of iron or zinc. There could be protein deficiency. That is why it's very important to ask the patient, did he have any kind of changes in his diet? Because this is crucial for most of the patients. Diseases of the thyroid gland, so some kind of autoimmune diseases, and gastrointestinal tract diseases. So in the case of gastrointestinal tract diseases, we understand that this is an issue with the absorption of the nutrition. So that can be a patient that maybe even taken some nutritions, he's taken the sufficient amount of proteins and so on, but because of the improper absorption, there also could be problems with the telogenic alopecia. So in general, before starting any kind of professional treatment, first of all, we have to understand the main trigger, the main etiological factor, if it's possible, of course, because sometimes we also have to work with other specialists like gynecologists, with endocrinologists, with gastroenterologists, and without their support, without their additional recommendations, that would be really very difficult to work with the patient. But in general, like the general recommendations would be massage of the scalp daily. This is really helps a lot because this is a significant improvement of the microcirculation, which is one of the steps of the pathogenesis of any kind of alopecia. This is the elimination of hypodynamia, yoga, stretching, general massage, sauna, bath. So actually everything that you can see here is more or less about stimulation of the microcirculation, because only proper microcirculation will give us the effect of nutrition, will give the effect of oxygenation of the hair follicle, which is actually really very important. And let's also remember about the water regime. It's really very important to drink water during the day because it will improve the rheological characteristic of the blood, which is also one of the factors of the proper microcirculation. So apart from general recommendations that we are given to the patient, our next step, of course, would be professional treatment. And here we will discuss several, first of all, mesotherapy products, which are Hair Loss Control and Hair Vital. Why mesotherapy? Of course, we understand that this is one of the most effective way to work with the targeted area. So here we can put active ingredients just in the targeted layer, just in the area of the hair follicle, in the dermis, to put everything, nutrients, vitamins, cofactors, amino acids, that would be building material, that would be some stimulating ingredients, just near the hair follicle where we expect the effect. So this method we can use like a classic mesotherapy, using Napash technique or using micropapule technique. Also, we can work with different devices like derma pen, so any kind of micro needling also would be great. And of course, together with that, we will discuss some kind of home care that will maintain or improve the result that you will get in the clinic. So first of all, we'll talk about hair loss control, which is the main product which is used in the case of androgenetic alopecia. So let's say hair loss control would be the product that mostly, I guess in 95%, we are using in all the cases of alopecia with male patients. Because here we have the ingredients which will inhibit the activity of 5-alpha reductase. So that's why for male patient, I guess, mostly you will use hair loss control, but don't forget that, of course, for female patients who have androgenic alopecia, we will also choose hair loss control because the etiological factors would be completely the same in the case of men and women. So here we can see the active ingredients that we have in the product: fenugreek, capixyl, sopalmeta, and a complex of pyridoxine and zinc and azelaic acid. So fenugreek is the active ingredient that will give us the effect of the stimulation of the microcirculation. So we will improve the oxygenation, the nutrition of the hair follicles, the income of other nutrients that patient may be taking with some nutritions. Or even that we are using topically, for example. Capixyl is a very potential innovative ingredient, which is biomimetic peptide, which is combined with the red clover extract. And the main functions of capixyl is the suppression or deactivation of 5-alpha reductase. So actually, in this case, we will prevent the transformation of androgens into its active form of transformation of testosterone into its active form, dihydrotestosterone. It will also improve the integrity of the extracellular matrix protein. So that will help to improve density of hair, that will help to prolong the phases of growth of the hair. Complex of azelaic acid, pyridoxine, and zinc is mainly having the effect of deactivation of 5-alpha reductase. So this is, of course, that we need in the case of androgenic alopecia, because this is the main etiological factor, the hyperactivity of dihydrotestosterone. Also, azelaic acid is a great ingredient that will help to balance the activity of the sebaceous gland. So that is why you can notice such kind of complexes in most of the trichological treatments. Sopalmeta, again, inhibitor of 5-alpha reductase. And as for the treatment protocol, so mainly we recommend to do around 8 sessions. Of course, first results you will see earlier. So the first results we can see on the 3rd session, on the 4th session, but it's recommended to continue the treatment. So normally that would be 8 sessions up to 10 sessions with the 7 days intervals. The intervals can be a little bit bigger if needed, so it's not a problem if you will do these treatments once in 10 days. But just for the convenience of the patient, already we have this treatment for around 2 months if we are doing 8 sessions. So not to prolong it for really a long period, it is recommended 7 days intervals. The protocol of treatment or the technique of treatment, of course, can be chosen by the professional. So if you prefer classic mesotherapy, like you see on the video, then of course you can do micropapule technique when you are putting like the depot of the active ingredients inside the dermis. We are working with the whole scalp, so it's not the treatment just only in the damaged areas, let's say. So we are working with the whole skin of the head, but you can inject a little bit more in the problematic areas. So if there are problems in the frontal area, parietal area, in those regions, you can inject a little bit more, so, or making more points of injection. I don't recommend to inject more in each point, but you can do more points of injection. Then, as for the efficacy of treatment, so I've already mentioned that you will see the results even after 3-4 sessions. But it is very important to, during the first consultations, like to explain to the patient what they will notice. Because some patient will say that, you know, doctor, I've seen that, for example, after our 3 sessions, 4 sessions, I'm starting to lose more hair than it was before. So I see some hair on the pillow. I can see during washing the hair, maybe I'm losing more. That's actually can be also in the case of the telogenic alopecia, and mostly with the telogenic alopecia, with the androgenetic alopecia less, but still that is possible, and it's something that the patient should be aware of, not to panic, not to think that something is going wrong. So if we are stimulating the hair, so of course we are stimulating the hair in all the phases of the development. So that means that those hair which were in the phase of falling out, let's say, we will also stimulate this phase of the growing of the hair. So just to prevent some kind of disappointment after the treatment, we have to talk to the patient to explain that they can notice that on the first sessions, but it's also good because it shows us that we are stimulating the hair, and just in a very short period, they will already see the activations of the sleeping follicle. So they will see that the hair will start to grow, and it's not an issue. As for the telogenic alopecia, so in this case, we are usually using Hair Vital. Hair Vital is a different product because here, if you will pay attention to the active ingredients, you will see that mostly this is like the building material for the hair. So here we have trace elements, we have enzymes, vitamins, which usually work like the cofactors of the synthesis of protein, like keratin, for example. We have amino acids, which is actually the building material for the proteins, and peptides, which will stimulate the growth factors and which will stimulate the growth of the hair. So amino acids that we have here are cysteine, arginine, methionine, and taurine. This is not only the blocks for building protein. These are also they possess also some kind of antioxidant activity, which is really crucial because in this way we can keep the cells from the damage which can be caused by free radical. Also, this is a great support and nutrition for the cells. The other ingredients like trace elements, enzymes, and vitamins usually work as the cofactors of different processes of metabolism and processes of synthesis. And panthenol we know like as a great ingredient for the hydration. So panthenol we need for the improvement of the quality of skin of the of scalp, for hydration, for nutrition, and also to have soothing effect. Adenosine promotes hair growth really in a very short period. And as for the treatment protocol, here again, 8 sessions are recommended, but actually in the case of telogenic alopecia, everything depends on the patients, everything depends if it's the first treatment or this is the treatment of maintenance. So if this is the patient who came the first time, so this is the first session of the treatment of such kind of alopecia, then 8 sessions would be recommended with approximately 7 days interval, let's say from 7 to 10. There are some patients who would come to you, you would invite in half of the year to maintain the results that you already obtained, so just to support them. In that case, there could be around 5 sessions. Also, Hair Vital is not just the product for treatment of telogen alopecia. So Hair Vital is also a great product for those patients who just want to improve quality of hair, or maybe they've noticed that there is more slow hair growth, or this is acute telogen alopecia. So normally they don't have any problems, but usually during the periods of hypovitaminosis or avitaminosis, they have this hair loss, usually during spring and autumn. So in that cases, even 5 treatments really would be enough. But again, it's very important for the patient to be aware of that during the first session, it's possible that they will notice more hair loss than it was before. This is that effect they will get just for a short period, usually normally during 1 week, maximum 2 weeks, and then already they will see the growth of the new hair. So with Hair Vital, also, you can work with any technique you prefer. That can be classic mesotherapy that you saw before, or that can be using with the devices like microneedling, like you can see in the video. Really, it shouldn't be some deep injection. Starting from 0.2, 0.3 millimeters, that would be enough. We are working with the whole scalp, but you can pay more attention to the problematic areas. So in that areas, you can do more points of injections or more layers, let's say, using microneedling, a bit of more product. So it's very comfortable treatment, both treatments like classic mesotherapy or microneedling is rather comfortable. There are no any kind of burning sensations during the treatment. Of course, everything depends on the sensitivity of the patient, but still here we don't have any ingredients that really would be too much uncomfortable and causing some pain or any other unpleasant reactions of the patient. So these 2 products you need for the active treatment, active professional treatment in the clinic. After that, we need to maintain the result. In order to maintain the result, we have really very popular product, which is hair lotion. And I'm sure those of you who already tried, those who's already recommended that to the patient, you know that it's really very effective. It works very fast. We are getting really good results just in a couple of weeks. And patients really love it. So it's the product which usually, if the patients start to use, they will use it really in all the cases of any kind of physiological issues, because they already know that it works very well. It's also very comfortable to use. So first of all, let's pay attention to the active ingredients that we have here. Again, we see here the complex of azelaic acid and zinc, which are the inhibitors of 5-alpha reductase. That's why this hair lotion we can use in both cases of androgenic and telogenic alopecia. That can be also used for both, for men and women. Here we have curcuma longa, which is really very effective active ingredient for the improvement of the microcirculation. So we will obtain the result like oxygenation and nutrition of the hair follicles. And again, you can see here this innovative peptide capixyl, which is the combination of acetyl tetrapeptide 3 and red clover extract. which we need mostly for the anti-inflammatory effect, because it will reduce or decrease the quantity of pro-inflammatory cytokines. It will also inhibit the activity of the 5-alpha reductase. It stimulates the production of collagen and stimulates the proteins of the extracellular matrix. Actually, this is almost all the effects that we need during the treatment of alopecia, or in the case we need to stimulate growth of the hair. Caffeine is also a famous ingredient reducing 5-alpha reductase and participating in different metabolic processes, and niacinamide for the activation of the microcirculation. So regarding hair lotion, how we use it. Hair lotion we can use between the mesotherapy. So what I mean between the sessions of mesotherapy, usually during the treatment, when we have our 5 or 8 mesotherapy treatments, between them you don't need additionally to use hair lotion. But once you stopped your session, so once you did all the protocol of mesotherapy treatment, after that, for maintaining the result, you can recommend your patient to start to use hair lotion. Also, another option of using hair lotion is using that without mesotherapy. So, unfortunately, we understand that there are patients, especially male patients, who don't like too much any kind of treatments which are associated with any kind of discomfort. So female patients, they are ready to go for mesotherapy, 8, 10 sessions, whatever. The more the better. Male patients, unfortunately, no. They want to have very quick results. At the same time, they don't want to feel any kind of unpleasant sensations during the mesotherapy, for example. So sometimes they are looking for some alternative. They are asking, what can I do without mesotherapy? So in this case, hair lotion would be really great alternative, because it is also very effective. You saw the active ingredients, and you also can write in the chats, those of you who already use, share your experience, because I'm sure that I know that this is a very popular product, and those who tried it once, you continue to work with that and recommending that to patients. It's also very comfortable to use, because the lotion is liquid, so it's not oily. It's not something that will give the effect of oily hair. It can be used both in the morning and in the evening. Actually, it doesn't matter, and it can be used every day, once or twice a day. The minimum period of the use of the lotion would be around 1 month, in the average recommendation. But again, here we have to be very individual, depending on the patient with whom we are working, because if we are talking about androgenetic alopecia, especially in the case of male patient, unfortunately, we are obtaining good results only when we are doing professional treatments or using home care with the inhibitors of 5-alpha reductase. Once this patient stop doing that, not doing professional treatments, not using products inhibiting the activation of the androgens, they will have the problem again. So actually, for such type of patient, hair lotion is something that they can use during lifetime. Unfortunately, there are no any other ways of treatment, maybe except hair transplantation. But if we are talking not about surgery, we are talking about cosmetological treatment, then here we need to maintain the result constantly. In the case of women with androgenic alopecia, here it would be more crucial and more important to find the etiological factors. So what was the reason? What was the trigger for that? And working with the maybe endocrinologist, maybe gynecologist, we can obtain really very, very good results if the problem with the main hormonal disbalance would be solved. Then hair lotion would be used just for a month or 2 months after professional treatments, and that would be completely enough. For those patients who have telogen alopecia, normally we are recommended to use hair lotion during autumn and summer period for around a month. So usually that would be after winter, in the case of avitaminosis, hypovitaminosis, and after summer also it is recommended to use hair lotion for around a month. So it will really give very, very good results. What else we can recommend to our patient to use at home? We also have really a great product in the HRP line. This is hair scalp peel. Mostly we can use it not only in the case of hair loss or any issues with the growing of the hair. This is also a great product which you can recommend to your patients to use in the case of dandruff or in the case of seborrheic dermatitis. And only if alopecia was the consequence of seborrheic dermatitis, for example, then that would be really great for the patient, like the second step of treatment. But in the case, if we are talking just about androgenic or telogenic alopecia, without dandruff, without any kind of seborrhea, then of course that would be not the first product we would choose. So pay attention to the active ingredients that we have here. That would be salicylic acid and resorcinol, panthenol, biotin, pyroxene, and selenium. So the main effect which we are obtaining from these active ingredients is, first of all, a bit of keratolytic effect with the help of salicylic acid. So especially in the case of seborrheic dermatitis, when we have not only hyperkeratosis, but also hyperexfoliation of the superficial layers of the skin. Salicylic acid will really help to get rid of the dead, dry superficial cells from the stratum corneum, and also that would be the general stimulation of the epidermal turnover. Resorcinol additionally will give us the keratolytic effect. It also possesses antimicrobic effect for the prevention of any kind of infection that can happen in the case of the injured or damaged skin barrier. And biotin is the one of the cofactors or coenzymes which participate in the synthesis of fatty acids. So panthenol is very common for us. Panthenol is really very potential and strong hydrative active ingredient. So that's why that would be really recommended in the cases with dry scalp, with the roughness of the scalp, in the case of peeling, itching, irritation. So it's not only hydrating, it's also soothing effect that we really need in the case of seborrheic dermatitis. So the combination of panthenol and biotin, there are clinical trials of the effect that we are obtaining from the complex of these active ingredients. And after 8 weeks of using this complex, in the case of 50 patients, there was noticed the reduce of the hair loss and the improvement in the density of the hair. The other active ingredient is pyroxene, and pay attention that pyroxene has antifungal effects. So actually it inhibits the synthesis of the ergosterol, which is one of the main components of the wall of the most fungi. So even in the case of the fungal infection, such kind of product will be really very effective. It will also reduce and decrease redness, erythema, itching sensations, burning sensations, any kind of pruritus. The same will do selenium. So selenium will reinforce the pyroxene because it also reduces irritation, it also reduces itching and soothes the skin. So the main indications for using that product would be seborrheic dermatitis of the scalp, dandruff of the scalp, and combined treatment of alopecia in the case that seborrheic dermatitis was the reason of the hair loss. How to use it? It is recommended to use at home during minimum 8 weeks. So if you will pay attention, we have a vial with the active solution, the vial with a specific applicator. So for the treatment, it is recommended to use half of the vial for the patient. So one vial they can use for several treatments. Before using the product, it is recommended to moisten hair and scalp. After that, with the help of applicator, we apply it to the scalp and massage until the full absorption. In 10-15 minutes, patient can rinse it off, can wash hair with shampoo, and this time of exposure would be completely enough. So this is actually semi-professional treatment, but at home, which really improve the quality of the skin of the head, which improves, balances the activity of the sebaceous glands also. So it additionally would be really a great tool that you can recommend to use to your patients in the case of those problems that we already discussed. So these are the main products that you can recommend to your patients to use at home, that you can use also professionally for the treatment of different kinds of alopecia. I know that most of you are familiar with these products because doing trainings in different countries, I saw really a lot of pictures before and after, which you are doing with the help of, which you are doing after the treatments of hair loss control, of Hair Vital. These are very popular products, especially in the Gulf countries. I also saw a lot of doctors with really great experience of using these products. That's why if you still didn't add them to your portfolio, I really recommend it to you. Also, I would like to pay your attention that we already have our innovation, which are in Exoma. And this is the exosome-like product, which is also recommended to use in the cases of different types of alopecia and also for the stimulation of the growth of the hair. So soon we will have webinars about exosomes. So there we will also talk about the peculiarities of using of them, about all the advantages of the Innoaesthetic exosomes. It will also be very interesting. So this is also an option that you can add to your professional portfolio of treatment of trichological patients. And that could be done actually like the monotherapy with the exosomes, that can be done together with the products Hair Loss Control and Hair Vital. And it will really be very effective in the case of such kind of patients. If you have any question regarding the products, please write me in chat. We will discuss these questions. How much effective between microneedling 0.3-0.5 millimeters or injection papule on the scalp skin? What the same result if we only use Hair Vital without hair care product from INNO, and how we decide to scalp peel first or direct Hair Vital? Okay, so the difference between mesotherapy, as for me, I can't say that I really see the difference between classic mesotherapy and microneedling regarding the efficacy of the treatment, but just for the comfort of patient, let's say, maybe microneedling would be more comfortable for most of the patients. Talking about comfort for specialist, for a doctor, just because this is a specific area and we have hair, working like with the classic mesotherapy is a little bit more comfortable, but in general, I can't say that there is one treatment which is more effective and the other is less. With the microneedling, of course, we have a bit of loss of product. That's true, of course, because it not because of the problem with the absorption of the product, but some quantity of product will stay on the hair. That's normal, but still, I don't see really significant difference. As for the depth of the injection, well, with the classic mesotherapy, usually we are injecting that on the depth of about 1 millimeter if we are doing micropapule technique, or 1.5 if we are doing that with the Napash technique. In general, that would be around 0.5 millimeters. Then the question, will we get the effect if we will just do Hair Vital without hair care product? If you're meaning without hair lotion, then yes, of course, we will have result from the mesotherapy. Hair lotion is not the product that you are obliged to do like the obligatory second step of the treatment. No, but in the case when you want to maintain the result, in the case when you have patients with really severe alopecia, which the problem which exists for a lot of years, then of course it's better to make this second step of the home care. But if the patient don't use that, it's also not a problem. Of course, you are getting really good results just after mesotherapy with the help of Hair Vital or with the help of hair loss control. But I've mentioned that in the case of androgenetic alopecia, you have good results while you are doing something, while you are maintaining. Once the patient stop doing that, stop blocking the activation of the androgen, stop blocking 5-alpha reductase, the problem will return. It's unfortunately the only way is to support. When the best time we mix the treatment in the same time, scalp peel and Hair Vital. You don't combine scalp peel and Hair Vital. So in the case, because after scalp peel, you need to wash the hair. That's why if you want to combine them, then first you are doing Hair Vital or hair loss control or any kind of mesotherapy or microneedling. Then you are waiting around 5 minutes. That would be enough, and you can use scalp peel in the case that then you can wash it off. Or like normally, this is the product for home care, so you are not doing that in the clinic. That's why that's the product that patient will use after that at home. Can we prescribe hair lotion for hair fall in young patient from 14 years old? So here is important to understand what. On one hand, there are no really contraindications of using that for teenagers or young patients. On the other hand, never ever you will get any official information that there were clinical studies with people less than 18 years. But what is most important is to understand why a young patient like 14 years old losing hair. So here, pay attention that Maybe, of course, maybe this is associated with, again, hormonal disbalance, because actually the etiological factors that we have that are important for the development of androgenic hair loss and for the development of acne would be completely the same. We have transformation of testosterone into its active phase dihydrotestosterone with the help of 5-alpha reductase. And after that, we have hyperstimulation and hyperactivity of the sebaceous glands, which starting to produce more sebum. So in this case, if you really can see oily, really very oily skin, then you need some products like hair lotion, which will contain azelaic acid, maybe a bit of salicylic acid. So here we have to work with the control of the 5-alpha reductase. If this is the case, I don't know, maybe there are some other triggers, but in any case, it's not common to lose hair in 14 years old. So here it's very important to understand what was the trigger. But there are no contraindications for using hair loss in that age. Injection of hair loss control and hair vital have any significance in treatment of frontal fibrosis alopecia? If there would be already fibrosis alopecia, so if we are talking about, because in that case we are talking about dead follicles. If there is nothing to stimulate, the same as we have, for example, in the case of scar, it's already the area with fibrosis. It's already the area with completely another tissue without alive follicles. If this is the situation when there is nothing to stimulate, of course, we will not get any kind of effect. As now we have, we don't hear this complex protocol, but just in case, of course, I invite all of you to the next webinars about the exosomes that we will have at the end of November. You will see the advertisement again in Instagram, in Facebook, in our social media. But still, so the combination with the exosomes, what you can do. Normally, we recommend 3 treatments with the exosomes. And the interval between these 3 treatments is 3 weeks. So in order to be more intensive, you can do, for example, during this 3 weeks interval between the exosomes, you already can use hair loss control or hair vital. Again, in the cases of really significant hair loss in severe cases, because in the patients with the acute telogenic alopecia, in the case of female androgenic alopecia, really get really great results, even with the monotherapy with exosomes, starting from 3 treatments. But not in, of course, in 100% of the cases of the patients. There are, I know patients, for example, with severe alopecia areata, which was really for a long time, and we didn't have any good outcomes after using of any mesotherapy products. But we've got really good results of using exosomes, but that was maybe after 3 months of using exosomes every 3 weeks. But that was really a severe case, and for that girl, we really need much more treatments. Mostly, that would be 3-5 treatments of the exosomes. So that is something that you also can add to your portfolio. If you have any other questions, please write in the chat. If maybe you will have some questions after, you always can write to Skin Academy. We will provide you with all the answers, protocol, information, and so on. Thank you for your time. Thank you for your attention. I hope you got some useful information that you can use for the treatment of your patients. And I wish you a great day, great evening, and see you on our next webinars. Thank you very much. Bye-bye.